Hi, it's David McIntosh from ENT Specialists. Have you ever heard of something called a deviated septum and wondered what that was all about? Well, I'll try and explain. The nose is separated into two sides, left and right, by a structure which is made of both bone and cartilage called the septum. Septums essentially come in two varieties, straight and crooked. When they're crooked, we call them a deviated septum. Now, deviated septums can be mild, moderate, and then quite severe, and often it's associated with changes on the outside of the nose, but actually more commonly, the outside of the nose looks perfectly fine. Most people with a deviated septum don't really recall an episode of where they might have sustained some trauma, and that's usually because a lot of these things possibly happen either at the time of birth or in the first few years of life. You fall over, you knock your nose, playing sport, bump, you don't tend to think about it too much. When it comes to deviated septums, this can affect your breathing. If you have trouble with your breathing, that may manifest itself in terms of mouth breathing or, for example, snoring. If you have problems breathing, then you may not have the full physical capacity either. There's some interesting research tying in deviated septums with problems with things such as heart disease as well. I'll just show you a picture so you know what we're talking about. So, if we're looking inside the nose, we have the middle part of the nose, and they can be crooked. So it can be crooked a little bit, they can be crooked quite a lot, okay? And the nose on the outside can be shifted across as well with it. Now, deviated septum is a structural problem, and in the mainstay, if it's a structural problem where there's significant symptoms, it's the sort of thing that surgery might be discussed. Now, as is the case with any surgery, there are risks involved, and this is something that your specialist would go through with you. So if you feel that your nose is not so great and the breathing could or should be better, talk to your doctor about seeing an ENT specialist. Have a good day.